You know, Greg's in medicine too, Larry.
Oh, really? Yeah. What field?
Nursing.
That's good.
I've certainly been teased as like, hey, Fokker, or Merce, you're a Merce. I think that came up in Meet the Parents at some point. There's certainly gender stereotypes related to different professions. Hi, GQ. My name is Peter Glennon. I'm an ER nurse in New York City, and this is The Breakdown. ER.
Let's go.
I'll respiratory when Amy gets into bed.
You know what she took?
I don't know. She just went into the medicine cabinet and got a lot of stuff around.
I have no idea what she has taken.
Juliana Margulies' character has come in. She's one of the ED nurses, and she is being treated for a drug overdose. Certainly in real life, her privacy would be the utmost importance. Just because you work someplace doesn't mean any of your rights are diminished. We take patient privacy pretty seriously.
I want a drug screen right away. 2 milligrams of Narcan and an Ampathy 50.
You want a pumper?
Yep.
The way he actually manages the patient is appropriate. He's going to give Narcan, which is a reversal agent for opioids. That would certainly be ordered quickly. They get their tox screen. They would order that too because they'd want to understand what a patient took who possibly overdosed, because it will certainly map out what the treatment plan would be for that patient. The Narcan's given right away, just in case it's an opioid, to try to reverse it, as you can have some respiratory depression as a result of opioid overdoses. So excellent care by Anthony Edwards.
Is that a mistake?
Repeat it twice.
Dr. Edwards orders Utox, and they're looking to see what, if any, drugs are within her system, so they see how they're able to treat, what the right treatment would be for her. It came back very, very quickly. 30 seconds later, it seemed like to me. It would take a bit longer, where certainly the lab, I worked with one of the fastest ones in the city, but it would have probably been about 10 minutes before that lab came back. They may have used a point of care where they're able to do it in the ER, the one I work in doesn't, but funny that it came back so quick. And in no way would 9 to 10 people surround a case like that. It would just be the care team treating that patient. Juliana Margulies' friend is there, and she's offering some information about what's happening with the patient. And it's interesting that she's in there while Juliana Margulies is getting treated, but it's important information. It can really direct the plan of care for that patient. So that's accurate. If it meant getting the information needed, she would be in the room with the docs and the nurses while they're treating the patient, because the information she provides can actually save Juliana's life. So it's important to get as much information as possible in an emergency situation like that. Meet the parents.
You know, Greg's in medicine too, Larry.
Oh, really? Yeah. What field?
Nursing.
That's good. No, really. What field?
Nursing.
I've certainly been teased as like, hey, Fokker, or Merce, you're a Merce. I think that came up in Meet the Parents. There's certainly gender stereotypes related to different professions. Nursing, certainly, I think people at one time thought of only women in that role. I think that's completely changed in the last number of years. There's a lot more male nurses out there than there were 10 years ago. Certainly the profession is majority women, but more and more men are turning to nurses as a career, and I think that's super exciting. The more diverse, the better, I mean, in all things.
I wanted to keep my options open, but in the end, nursing was just a better fit for me. It gives you the freedom to work in several different areas of medicine. Plus, I can focus 100% on patient care as opposed to being a doctor where you have to deal with the bureaucracy.
Oh.
I can relate. Often the question you get asked as a nurse is, well, why didn't you become a doctor? And my answer typically is, because I didn't want to. Greg's talking about his passion for patient care, and I think that certainly is a common thread through all nurses, whether they're in the emergency department or in the ICU or on the medical surgical floor. It's a different connection to the patient than a provider has. It's certainly a special one. It is certainly a calling. You really have to have that empathy and and desire to aid in the healing process to be a nurse. It's something that always spoke to me. I was actually a paramedic. I would drop patients off at one of the emergency rooms in my area that I worked, and there was a guy who was the triage nurse, and he was a super cool guy. And he had his white jeans on every day and his cool shirt, like Hawaiian almost shirts. They had no dress code at this hospital, I guess. But the way he interacted with patients was just so warm, and he was so smart, and he always knew what to do and knew what they needed, that it inspired me to become a nurse, actually. I saw some representation there that I could identify with, and I wanted to be like him. The upside.
Done. Young Merlin's got the sword.
So that would make my penis the stone, then?
Can you stop saying that word?
Just using your analogy.
Stop saying the word. I'm asking you.
Okay.
It's not helping me.
Okay.
All right, so I'll take this out. And then I gotta pinch the head, put it in. All right?
We see patients present occasionally with urinary retention, and this is a very painful condition, and if left untreated, can really cause damage to the bladder, bacterial infections, and in late stages of it, kidney failure. So us having the ability to place a catheter is super important. It, one, provides relief for the patient, and also can avoid those complications once that catheter is placed. Clearly, Kevin Hart is not a registered nurse based on his performance here. Placing a urinary catheter is a very serious procedure that can, if not done appropriately, cause infection. So there's a lot of preparation done to ensure that it's a sterile procedure. Also, a registered nurse or a doctor or anyone in the healthcare field would respect this patient's anatomy more appropriately and make them comfortable and not have this kind of banter. He's removing the catheter, and then it seems like he's about to put it back in, but he's not creating a sterile field. His hands are everywhere. We would create a sterile field, wear sterile gloves. It's a very thorough process to apply them as to maintain that sterility, and that takes some time, and we actually do it with another nurse to ensure that they can verify that we actually did maintain sterility before putting a catheter in. Nurse Jackie.
I know you. I just had to sit there and look that kid's mother in the eye and tell her that we did everything we could, you dumb shit. That was my patient. I told you he was slipping, and he was. I tell you to order a scan, you order a goddamn scan, because if you don't do it, I'll just go to the next doctor, and the next doctor after that. In the meantime, that kid died. It's
just so out of the realm of reality that would happen in a hospital. There's so many things wrong with that scene. If she had a concern about care, that would have been addressed in real time, and she would have escalated and gotten resources to assist her. A conversation like that they were having, I would immediately want an HR person to come. Yeah, that man wouldn't work in a hospital, no. House.
Thank you for joining me for tonight's dress rehearsal. Playing the part of Andy is Morty Randolph. For his donation to science, we give our thanks. Once Andy is cooled and goes off bypass, we have 60 seconds to get 2 liters of blood out of her body, back into her, with pictures to find the clot in her head.
In the ED, we're certainly not doing it on a cadaver, but we do practice a lot. And as new nurses, we spend a lot of time in a sim lab where we use some advanced robotics that mimic different situations, whether it's a patient, the way to manage them lowering their blood pressure is really low, or they're having difficulty breathing. Most recently, we set up some sim where I work to handle an imminent delivery of a baby, which happens in the ED occasionally. So it's such an incredible way to learn. You certainly need to read the book on how to treat a patient, but actually going through the muscle memory of it and the physicality of it is pretty incredible, and such a great resource for both the person who works in a hospital or a registered nurse or a doctor, but also what that means for the patient, the great skill set that someone can develop using simulation like that. Certainly a surgeon or a doctor or a mid-level provider potentially would do skills on a cadaver. That definitely happens.
Sorry, my hand slipped.
How hard can this be?
It's a little busy down here.
Again.
If we didn't have to lavage your gastrointestinal...
Again.
You should be able to hear a pin drop in that room. It's usually really quiet. Usually the provider that's leading needs to be able to direct different folks to do different things, whether it's give meds or provide respiratory support. So it's really important that only the right people are there and that there's a state of calm in that environment, so we can hear each other and that nothing is critically missed. It's really something amazing to behold. It's almost like a symphony, the way people work together in an environment like that. It's a really impressive thing. Grey's Anatomy.
Hey, Cassidy, the doctor said the labs and imaging showed an 8-week pregnancy, so you're all clear.
So that's it, it's just the pill?
2 pills, actually. You'll take 1 medication now to block the hormones that keep the pregnancy viable, then a 2nd pill in 24 hours to help contract the uterus. You'll feel nauseated and crampy, probably emotional because hormones.
She's giving a great summary of what the medication does. So great job by the nurse in that scene. I haven't watched Grey's in a bit, but it's on season 47 at this point. In the first few seasons, they really underutilized or underrepresented the scope of practice of a registered nurse. You see a lot of them doing sort of like cleaning tasks, which are certainly important in a hospital setting, but they don't really demonstrate really what a nurse does in terms of the knowledge base they have, the monitoring, the clinical skills in terms of like assessment and showing what the status of a patient is and how important their role is in identifying problems that may arise with a patient in a hospital setting. They are sort of these ancillary characters in these shows sometimes. It really just doesn't show like their true nature in the hospital setting. MASH.
This one's in shock, needs hemorrhaging. A unit of whole blood. Stat. Come on, take him. Okay, it's his leg. Do a sterile prep. Move it, hurry. At his chest. He's in pain. MS, 1/4. He'll be next in OR. Come on, move it. We've got more coming.
So we see Major Houlihan triaging patients, which was completely appropriate. She's doing what they call a Gestalt assessment, which is just really trying to rapidly understand what's going on with that patient and what kind of care they're gonna need. Certainly, I've never seen a triage nurse in a wedding dress at work, but the process is important. You have to understand and make a quick judgment about what's going on with a patient and get them the care they need. What's her accuracy rate? I couldn't tell you, but I think her judgment in the setting that it is, she's probably getting those folks the best care possible. In the emergency department, we do a lot of planning around multi-casualty incidents. We call them MCIs. And there's a lot of algorithms on how to manage a high volume of patients that would appear suddenly. It's all about resource utilization and how do we use our resources to best treat the largest amount of people. So we certainly would classify the extent of an injury or whatever's happening with that patient and try to timely get the people who need the care the fastest to get that care. And if there are folks that potentially could wait a bit, we're certainly gonna prioritize the severity of the injury. Pearl Harbor.
Wait here!
Don't touch me, you jab! Get your hands off me! It's critical, get him into critical!
Critical from board!
How bad am I?
You're gonna be just fine, sweetheart.
I don't want to die.
You're not gonna die, sweetheart. I got your hand. Give him enough morphine to make him comfortable. He's not gonna make it.
It's very important that we not mix patients up when so many of them come at the same time. Where I work, we actually have built an algorithm called MCI the first hour to ensure that when faced with something like that, you have the necessary tools and you prioritize your resources to get the victims of a situation like that the best possible help we can possibly give them. We see Kate Beckinsale, she's running around, she's trying to triage as many patients as possible. She's using her lipstick, and you see she writes the C on one patient. They're critical, they need to get care right away. They're gonna go right in and see the doc, and then sadly, she writes an F on another patient. She has made the assessment that they are too far gone for care and that they unfortunately will expire in the near future, and that they would be a drain on resources. In real life now in 2021, most MCIs where there's a lot of casualties, they use a START triage system, and that is a way for pre-hospital folks who care for patients in the field to tag different patients with different categories. And, they're looking at what's the mental status of the patient, what's their respiratory status, how's their circulation, are they bleeding, do they have any significant injuries? And they will actually tie a tag to folks in an MCI in those different categories. Some, sadly, if they're deceased, or if they have minor care, sometimes just a minor cut or bruise needs to get assessed, they'll check that out. So they'll have a green tag. There's also a yellow one that means delayed. They are not in an urgent need to get care right away, but they may have an injury or something happening with them. And then you get to critical, a red tag, and that means that patient really requires rapid intervention. Kate Beckinsale grabs her stocking, and I think she's using it as a tourniquet. Fortunately, we don't need to do things like that. One, it's a huge infection control problem. And two, in the hospital setting, we don't need to MacGyver things. We have what we need. We understand the tools. We train on those specific types of tools. I have never really seen too much MacGyvering because you want to use equipment in a way that's really safe for a patient. So it's important to utilize the appropriate tools at the appropriate time in the appropriate way. John Q.
Good. Done. A bit of that. Pressure up. Pressure up. Now, 1, 2, 3.
When you're in a hospital setting, the use of a defibrillator would be so accessible, there would be no reason for him to do that tap on the heart. Certainly, we don't recommend people punching people in the chest. The current recommendation is you would always go for a defibrillator, so that wouldn't happen in today's world. Staff, certainly their safety is paramount, so if there was a hostage situations, many hospitals have different codes with a color coordinated. For a hostage, we would have a specific color that the staff would be educated on, and there would be an announcement through the building if, God forbid, there was a hostage situation. Dr. Death?
This isn't right.
No, it isn't. We gotta run stat H&H.
You need to say something. Oh, shit. Should we start the cell saver, doctor?
Focus on your job.
As a nurse, your job is to advocate for your patient, whether they're awake or undergoing surgery. So there wouldn't be this shyness when the situation isn't safe. That's our duty. The culture I work in really encourages a team member to speak up, and despite hierarchy or what your role is, and that kind of culture serves the patient.
There's a lot of bleeding, doctor. We should get an A-line kit, 14 gauge IV, blood warmer. Maybe give ICU a heads up.
And we have an algorithm we would follow. So if we feel like something isn't going well, we want to first voice our concern, be like, hey guys, I'm really concerned about this. And then if there's no response to that concern, then we're gonna yell, I'm uncomfortable with this. And then lastly, this feels unsafe. And so we all say that to each other as a team. Always, certainly where I work, that first I'm concerned, we would all just stop what we were doing to have a conversation if we feel like whatever's happening isn't the right course of action. We're the patient advocate, so we want to make sure that the patient's getting the best possible care.
We gotta get this under control, doctor.
We? You mean me? I need to get this under control.
Yes, doctor, you need to get this under control. Perhaps we bring in vascular.
What's vascular going to do when
Naval
you can't get the blood pressure under control?
It's not an issue with the blood pressure.
Well, why don't we start there, shall we? See the disc.
What is blood doing for us? It's providing oxygenation to the body. So if it's leaking out all over the floor, it's certainly concerning. We can exist with some blood loss, but at a certain point, we wouldn't be able to maintain life. So he's worried. He feels like that's too much blood loss, and the surgeon in this scene doesn't seem to be concerned or is willing to play with how much he can actually lose without causing harm. Certainly, the docs I work with, this would never happen. Just, this is definitely one for a movie or a TV show. The Knick.
Christ, the bullet's lodged in the tunica. It's the only reason he hasn't already bled to death.
Do you really think we'll be able to save this leg?
I'm not even sure we can save the man.
If someone has a leg injury like that, we in the ER are gonna stabilize that leg. And depending if there's different types of ERs, some are trauma centers, some aren't. Different kinds of ERs can handle different types of emergencies. That guy definitely would have needed a trauma center for a gunshot to the leg because it requires special kinds of surgery. So we would stabilize that patient and we would get them to a trauma center. And within the trauma center, they would be stabilized in the ED and be sent right up to the OR for treatment.
You need to take the leg off now. It's already showing signs of necrosis.
Can't get the broken bones to set.
His pulse is eccentric. We need to amputate now.
Amputation, definitely not an ER procedure. Certain types of cancers today in trauma could require some amputation. That's a thorough process, and a lot of specialists would have to weigh in on to make a decision like that for a patient, with the patient. The gentleman is trying to irrigate the wound for him using a giant syringe, I guess, which is like salt water. It's the same osmolarity of blood, and he's trying to clean the wound. Today, we would certainly use sterile water or saline. That patient, probably with all the fingers and such going into his leg, probably would get a nasty infection. That poor man and his leg, I certainly sympathize for him. Thanks so much for watching these clips with me. I hope you learned something. Until next time.